Today we are talking about something which is affecting all of us, which has affected not just us here in Queens, New York, America. Across the globe, people have felt the hurt caused by invisible enemy, as is referred, COVID-19. Before we start talking about it, I want to briefly express our collective condolence, sympathy for the families that have lost their loved ones. In America, that figure is about 200,000. In New York, the figure is about 19,000, and in Queens, it is more than 3,000. Each life is precious, and how to save lives and how should we address the threat that is still around us, lurking in this or that form. The measures that we have taken, are they enough? Is there something more that needs to be done? To tell us all about it, we have COVID special consultant, if I say Dr. Srinivas Rao from India Home joining us. Namaste, Dr. Welcome. And with him, we have Deputy Director of India Home, Shaaranya Pillai joining us, as well as Selvia Sikder, Program Director of India Home, also joins us. I thank you all for taking time and addressing this important issue. Let me begin from a layman's point of view, and so I would request Sylvia, you have worked with community, things have changed. How do you see the degree of apprehension and fear that you still find in people while you interact with them with respect to COVID? Sylvia.
Thank you very much, Ashok, for inviting us in your show today. As you know, like India Home, we work with the seniors. During the pandemic, we had to close our centers. So when we closed our centers, then we started doing all our programming virtually, and rapidly we started doing changing our programs. We started doing the wellness checkup phone calls, and it was not only with the seniors at all. Like that time, we started connecting with the families, and very heavy heart, I would like to inform that 8 of our seniors that we lost during the COVID time, and these are from our all 3 centers. So while we were doing our programming and this COVID happened, every day on a regular basis, we were informing them about the COVID, what's going on, and how we can help them. Seniors are the most vulnerable population. So we started providing them the home delivered meal services, so that the food security they will have. We started providing the home delivered meal services and the grocery deliveries, so that they don't have to go outside. At the same time, we are coordinating with them so that some of the seniors, not some of them, most of the seniors that we are serving, they are vulnerable, they have chronic health conditions. So they have to get the medications, they have to go to the hospitals, or they have to go to the pharmacy. So that time we decided we will coordinate with them. So we make that arrangement so that they get the medication at their home that can be delivered at the time.
Yeah. Sylvia, let me come back to you. I appreciate this insight and how you are addressing the major concerns which senior population is facing. Such coordination is priceless at time such crisis unfolds. And before we learn more about COVID and why it is affecting the way it is affecting, we have heard about various viruses coming and going. But before we get to the scientific side of COVID, as someone who has lived in New York and enjoyed outside life, Shaaranya, for last couple of months, you have been pretty much confined to home. Now things have started opening up. Do you feel more safe as compared to March now? Where do you see people taking it lightly, or they still pay attention to the protocol?
Yeah, I think that, and again, thank you for having us on this show to be able to speak about this topic, because it is very much still a pressing issue. And I think if we don't all take it seriously the way that we had in the beginning, we could see a lot of serious consequences. And, it is relatively safer. I think, as you can see, I am stuck in my house because quarantining is still very important. But I do think that people are gradually have become more lax over time. Seeing as the rates have been relatively low, and we really saw the worst of it at one point, or what we perceive as the worst of it earlier this year. So people have become a little bit more lax, but I think that does not mean that it means that we still do have to take it seriously. And if we don't continue to enforce the precautions, regardless of age, because we see that the spikes that are happening globally are oftentimes from the younger people. And with schools reopening, with the outdoor, dining becoming not happening as often, with indoor dining becoming opening up, we have a lot more risks coming up in the future and happening right now that we have to be aware of and cognizant of. And we have to still take it seriously if we want to ensure, the betterment of our community, for sure.
Absolutely. So initially lockdown was implemented. People were very, very careful, self-disciplined, but the gradual flow of time and the intense days when every day we were losing people to the tune of 800 or 1000, gradually we got control over that. So Dr. Rao, now people are thinking things are normal. Of course they are not as normal as they should be. It is a new normal. So let us learn a little bit more about COVID-19 and why it is so sinister. What we know as scientist community, as per your understanding, and allow me to add, many times we feel that because of the symptomatic patient, so you don't have any symptom, but you might be affected by COVID. That causes confusion, and how it is going to spread. There are various views that you hear, and sometimes you think this contradicts that. So let us hear from you on all these.
The first point I would say for anyone to understand is that this is natural. We are all lucky in 2020 that we are able to detect it rapidly. While in the past, it was very difficult to detect. Not only we could detect, we can stop it. Not only we can stop it, we can protect ourselves now. But the main issue is not the virus today that is causing a big trouble for the world. It is the lack of awareness. The virus, probably hundreds of people might have said it, the virus outside a human being is dead. Only when we get it, it is alive. And therefore, the awareness to stop it is the fundamental thing to fight it or to eliminate it. It can be eliminated if we are all disciplined. At the same time, we can detect if someone is having a metal in a bag somewhere or bomb material somewhere. And the size of the molecules of those bomb material or metal being detected are very, very small compared to the virus. So we surely can detect the virus too, without really making this kind of big testing programs. But as a country, as a world, we didn't pay attention to that kind of research. We always focused on various other non-essential things compared to health. That's the first point. So the priorities, even now, if we can change, it will be wonderful. In a year or so, we'll be out of the fear.
Yeah. So, Dr. Rao, I'll continue with you, and I just want to seek input from Selvia on the question of testing. Many times people are scared that if they go for testing and if they are positive, then they'll be forced to quarantine, or their family would face certain additional challenges. And have you come across families who are kind of reluctant in going for testing, Selvia?
Yes, it's a good question because in our case management department, we always make the phone calls to the families with the seniors. As I told you, like while the centers were open, we were just only interacting with the seniors. Now, while they are in the home, we are not only interacting with the seniors, we are interacting with their family members. So now we are making the regular phone calls and informing them about taking the testing and tracing, like the COVID testing or antibody testing. So while we are informing them, like they are just informing like I'm absolutely doing fine. Why should I go? Or sometimes we have to these type of seniors or their family members, they are saying like they have the concern, they are doing pretty well, but if they are going to the testing site, they might get affected after going there. So how we can help them in that situation? Or also we have some of the seniors that we are serving, as you know, like most of the seniors, the community that we are serving are living in overcrowded housing situations. They really don't have the place to quarantine. So that's another issue. They feel like, okay, it's better to stay at home, not to go outside, so that we will not get affected with any kind of virus. And we are constantly calling them, but like it's really really hard to make them understand just due to the situation and the circumstances, because and as you have heard, like there is the city is offering the free hotel program. We are also informing them, but sometimes they are reluctant also to take that opportunity. This is like like we should not go. We are absolutely doing fine. There are a lot of stigma around this COVID situation now in the community. I would say they are not feeling comfortable at all.
Yeah. So, Selvia, thank you. When you say stigma, actually, what we have heard, what we see, if you go to the hospital, your family cannot come to visit you. And there have been unfortunate cases where if they lost their lives, still family members were not in a position to meet them in the last few days. We'll come back to Dr. Rao, but Shaaranya, many people worry about not having proper health insurance, worrying about is it going to cost more. Do you have some idea what is it that the government has done for people to have free COVID test?
Yeah, I'm glad you brought that up. There's actually a lot of testing sites where they do not ask for insurance and that the testing sites are free. There's actually a website with a tool that's really nice where you can put in your address and it'll pop up different searches around the map of where you live, different testing sites for antibodies, whether it is whether they take insurance, what kind of insurance they take, the hours that they're available. The city has really been trying to put out the word about all these resources out there, and there are indeed free testing sites. I know the one closest to my house is Jamaica Hospital. They have a free testing site. And so that should not be a barrier to getting tested, and the city has ensured that. So I definitely can assure you there are a number of tests. You can find a testing site near you actually at their website. It's nyc.gov/COVID test. And if you put in your address, you can find the resources near you.
Yeah, thank you. Thank you. That's very, very valuable information. And now back to you, Dr. Rao. You were mentioning that if we are disciplined and this virus is dead outside our body, so what should we do to make sure that it doesn't reach any human body? In that context, do you think getting oneself tested for the possibility of having COVID-19 is important?
Yes, testing should be so simple. There is nothing to be worried. The only concern, including myself, is if I have to go to some place where many people come, would I catch from others? That fear should be eliminated by the people like India Home, community organizations, government, New York City Health Department, and at national level by CDC of the measures that we are taking. And many things that are confusing, as you said earlier, about the virus, because virus is not inert and silent. Once it is in your body, it multiplies in billions and billions of times, or even trillions. When it is multiplying, it is changing. So right now there could be several thousands and thousands of varieties of this COVID-19 that is infecting us. Some of them are very simple. Some of them give a lot of infection. Therefore, if we have to really stop it, the knowledge about it should be transmitted to the people. Giving the hand wash, mask, these kind of physical things are definitely a must. Physical distancing are definitely a must. Beyond that, the fear, if it is removed, I won't have any problem to go to get tested, and I don't have any problem to go and meet someone who may be asymptomatic, silent carrier.
So right now, Dr. Rao, as I speak to you, we are already in the month of September, just few months to go for 2020. And this whole year almost, starting from February, when we started hearing about COVID in America, but from January it was seen in Wuhan, Chinese territory, and then people were thinking that it is going to stay only there. Now it has spread across the globe. Before I come back to you, Selvia, how do you see people observing these suggested measures of maintaining distance, wearing mask, etc.? Are they open to these ideas, or we have seen some people actually not in New York that much, but who demonstrated that it is their freedom and they live in a free country, etc. So, in general, what do you see people's response to these suggestions?
Thank you for bringing up this issue. As you know, like India Home is also doing the outreach for providing the information and distributing the mask and how to maintain the social distancing. So, our staff and everyone is doing the outreach in person. So I'm also fortunate one that I had to go to one of the outreach, and we figured out, like, I was just in a situation, it was inside of me was thinking like, okay, while we're gonna distribute this mask, maybe people will not be that willing to take this mask, but honestly speaking, people are willing to take the mask, and while we are informing them, they're taking it very positively because everyone is worried. Like, it's very less people that we have seen are not willing to take masks or wearing the mask. If some of them, like very few, I'm saying, some of them we also have encountered were like skeptical, and then they were like reluctant, and they were not even sure. Like, they were saying like, no, we're absolutely fine. We are not having any issue. We don't need any mask, anything. But most of them are aware of the health, and because like in New York City, this is the epicenter, and especially in Queens, while they have seen how many people have lost their lives, their family members, so now they all are concerned. Like, we have seen like people are stopping by to us and even asking like, hey, where can I go and get tested? How can I get this information and that information? Everyone is asking. And also one more thing, like I'm just like informing you one more thing that you asked the previous questions, like are they willing to take the testing? So in this situation, I can tell, like, for the immigration, some of them are not they are not willing to take the testing because they have that fear, like if they have to provide any information that might be gonna be a problem for them. So because like there are so many undocumented people living in New York City, right? So due to that, their immigration status, that is like they are hesitant to go for the testing.
Yeah, so I think that's another relevant point. And let me just show my mask here. This is one of the masks. There are multiple types of masks that are available, and some people are using masks as fashion statement. They find some matching masks to go with their attire. But what has been your observation as well as experience, Shaaranya, in terms of people paying due attention to washing their hands, making use of all these liquids to sanitizers, and again, maintaining social distance?
I think in terms of maintaining good hand hygiene, I think that is something that we have to kind of inform our family units. Like for me, I'm urging my parents to continue doing that. I think if all of us take it as our duty to inform each other and inform our networks and inform our peers whenever we're out, okay, we're just sitting down, I think it's a good idea for us to use hand sanitizer. I think that while there was an awareness, as I said earlier, I do think that people are becoming a little bit more lax. So there still is very much an importance to continue practicing good hand hygiene, carrying hand sanitizer with you, and continue washing our hands, because that's how, as Dr. Rao said, in a year's time, we can have less of this fear and really reduce the duration of this.
Yeah, thank you. And Dr. Rao, probably we'll have one more extended session with you on coronavirus, understanding various nuances or aspects related to it. But few minutes that we have today, I want you to help us understand, do you foresee we will be able to stop it in near future? And in order to achieve that objective, what do you expect from common men as well as policymakers?
Yes, today the society, the world entire, has enough science to stop the virus. And the first place where that science has to be very effective is common man. As I said, it is a natural occurrence. Then you can ask me, Mr. Vyas, if it is natural occurrence, what happened in the past?
Okay, so allow me to just interrupt slightly. You began by saying it is natural occurrence, and I was thinking that we hear everybody saying that it is made in Chinese laboratory, including President of USA recently blaming China for this virus. So when you say natural occurrence, where are you coming from?
Oh, I actually wrote a full-length essay. Thousands have read it, about its origin from a Chinese lab. But precisely, though it is not the place, it is precisely not just the Chinese lab. It is the help of the Americans funding, American research, French support, that probably has helped the Chinese lab to make this kind of virus until the time they prove in a very simple logical test. I have written completely on that, and that's one of the most well-read essays that I have written.
Absolutely, no, I'll read that, but that means you cannot call it natural, or can you?
Yes, this particular one, we still have a dilemma because the Chinese government or the Wuhan Research Institute did not submit, or Professor Ralph Barrick, North Carolina lab did not submit a full testing. But when I said natural, in the past hundreds of years, these viruses are coming. If you just remember what we are saying in the few words, keep a distance, wash hands, cover your face, all these are religious practices. They have become religious practices because people's behavior can be modulated in all the religions through the religious practices. And in a year's time, we all get used to it, and therefore it will come down. In a year's time, nothing specifically happens to the virus. Like you and I are living, it also will be living in the human bodies if we are not careful. Otherwise, it will be like sand particles outside.
So, Dr. Rao, considering that we are out of time, I would just ask you one unscientific question, and that is a hypothetical question. Based on your observation of the way people behave and respond to suggestions of scientific community, can you have some projection as to the day when we can say is the expiry date for coronavirus?
Yeah, not just myself, but Mr. Bill Gates, with all his big team members, who actually predicted 5 years back that this would happen, is predicting now in 2022, we all will be fairly normal and out of the danger of what we are seeing right now due to COVID-19.
Thank you very much, Dr. Rao. So let us pray and observe all the needed measures to reach to 2022 safely. And that is where I would thank Selvia, Shaaranya, and Dr. Srinivas Rao, all starting with S, joining us in moving towards a safer world. Thank you very much, and thanks to all of you for being a part of this conversation. This is Ashok Vyas. Lots of good wishes.